What is the most appropriate next step in management? Discharge with pain medications and return if symptoms worsen. Immediate, immediate open reduction in internal fixation. Repeat X-ray in 7 to 10 days and immobilize the wrist. Refer the patient to a hand surgeon for evaluation or administer corticosteroids and monitor for improvement. A 21-year-old male presents to the emergency department after falling on his outstretched hand while playing basketball. He complains of a pain in the wrist and difficulty moving it. On physical examination, there is tenderness over the anatomical snuff box. An initial X-ray of the wrist does not reveal any fractures. What is the most appropriate next step in management? Okay, so there is no fractures. Okay, it says pain in the anatomic snuff box. So there's probably the scaphoid bone in the snuff box. Let me see. Discharge with pain medications, return of symptoms worsen. Immediate open reduction. I don't think it's immediate open reduction in internal fixation. Repeat X-ray in 7 to 10 days and immobilize the wrist. I don't see any reason to do an X-ray as like there's no fracture. I do wish immobilize the wrist would be a different answer choice entirely. You never refer to a patient to a hand surgeon. I feel like that's a question, like a strategy I picked up is like you never refer the patient. Administer corticosteroids and monitor for improvement. Okay, my gut right now is saying discharge with pain medication is what I'm thinking.
Okay. You want to keep it or change it here?
I don't know. I'm thinking right now. So this is what I'm saying. Like at this point, if I were doing this question like really like this on test, I'd probably sit here and like probably another 2 minutes and think about it. Is there any reason to do that or no?
I would say that, I would say this, right? With the way that you've walked me through it, unless you have kind of big pieces of evidence where you're just like, you know what, like this, I'm 100% sure that this is the reason why this answer is correct rather than this, then, then yeah, sure, take the 2 minutes. If not, then I would say that you kind of just got to pick an answer and move on, right?
Yeah. And now, I mean, I'm thinking that this is probably what would actually happen if I just went to the doctor and said, hey, like my wrist hurts. And they say, okay, like here's some, I don't know, here's something. Let me know if it gets any worse. I feel like that's honestly what it would be. I don't know. I'm thinking that.
Okay, you want to go with this?
Yes.
Okay, so let's talk about this. Okay, so the reason why it's C, okay, which is repeat X-ray in 7 to 10 days and immobilized wrist. So you have to kind of understand, in a sense, right? Get a little bit deeper to what this question is really asking. So you got the diagnosis correct. Okay, what was the diagnosis?
It's like a injured scaphoid bone.
Yep, scaphoid, right? But what is notorious about scaphoid injuries? Do you know by any chance? That's the real question. The question really is, you know that it's a scaphoid injury, but what are some of the complications that you can have from scaphoid injuries?
Oh, I don't know. I'm
So remember,
thinking, yeah.
go ahead.
I'm not sure actually. I'm thinking because I know that the other stuff, I'm maybe something with like an arterial being shattered or something like that. I have no idea.
Yeah. So you can lose blood supply and this can slowly deteriorate, right?
To lead some type of
So
necrosis.
yeah, so you can have some necrosis, right? And initially speaking, right? Remember, scaphoid is a small bone, so initially speaking, right? This might not show up on the initial X-ray, right? So what ends up happening is you want to make sure that you're not, as things progress, right? It maybe some of the scaphoid then kind of slowly dies. You can see the fracture a little bit better. So you want to repeat this X-ray. So really what they're trying to get you, the real question is really not what's the next step in management. You have to rephrase it. The real question is, when you have a scaphoid injury, what are things you got to look out for, right? That's really the question.
Okay. And so the reason this is the right answer is because um it could lead to like I don't want to say necrosis, but like it could lead to an injury, further injury, and that may not be picked up on the X-ray the first time you do it. And so you want to do a repeat X-ray in 7 to 10 days after the damage may have been done or not have done to see if there's any
Yeah,
damage.
long-term damage. Yes, exactly. Right. So the issue with this is, let's talk about it just on a clinical standpoint, right? If you discharge with pain medications, right, and symptoms worse, right, you're leaving that up to what? That is a subjective thing, right?
Yeah.
So like, for instance, right, when do you think the most pain is going to happen is probably the initial injury. So let's say
Yes.
it continues to stay hurt, but now you've kind of masked the pain, right? So how are you going to tell if the symptoms worse? That's really subjective, right? So the best thing, what I mean by subjective, that means the patient's telling you, right?
Yeah, for sure.
Um, And as you already know, right, pain is highly subjective from one patient to another, right? So not super reliable. So the best way that you can objectively reevaluate is get another image, right? You can't, that's really
Yeah,
objective, right? So
exactly. Okay, that's actually a good way to think about it.